Hello, I'm Craig Jensen, a pediatric gastroenterologist at Texas Children's Hospital and Baylor College of Medicine. And in this clinical pearl, I'm going to discuss prebiotics, the basics. So it's important to know what a prebiotic is, and it also is important to understand the difference between prebiotics and probiotics. So probiotics are live microorganisms which, when administered in adequate amounts, confer a health benefit to the host. A prebiotic is a non-digestible food component, largely a selectively fermented ingredient, the ingestion of which results in specific changes in the composition and/or activity of the gastrointestinal microflora in a way that confers health benefits to the host. So a probiotic is actually a live microorganism. A prebiotic is a food component that encourages the growth selectively of different aspects of our microflora in a way that will benefit us. Recently, we've seen the addition of prebiotics to infant formula. Prebiotics that have been studied during infancy include fructooligosaccharides, galactooligosaccharides, and polydextrose, among others. These differ in terms of where in the colon their fermentation occurs. The simpler oligosaccharides from a molecular standpoint undergo fermentation more proximally in the colon, and more molecularly complex prebiotics have fermentation occurs throughout the colon. What about the breastfed infant? Often overlooked is the fact that breast milk contains substantial amounts of oligosaccharides. We all know that lactose is the predominant carbohydrate in breast milk, but as I mentioned, there are significant amounts of oligosaccharides of many different types in breast milk. Lactose itself actually, in the view of some, would meet the definition of a prebiotic. So do we have any evidence that these prebiotics are, number one, safe, and number two, confer any benefits? In the clinical trials that have been done, prebiotics have not been associated with adverse events, so their safety profile is very good. The one clinical outcome that has been seen in a number of these studies is the fact that infants fed formulas containing prebiotics had softer stools than those of infants who were fed formulas that did not. This has generally been viewed as an advantageous outcome. There are suggestions of other positive clinical outcomes from a few of these trials, but really from the standpoint of any definitive statements regarding other clinical benefits, we're going to have to await the results of additional clinical trials. So in sum, prebiotics generally are these non-digestible food components, oligosaccharides in general, that encourage an alteration in our flora in a way that is beneficial. The currently used prebiotics in infant formulas appear to be safe and typically result in softer stools. Thank you for watching this Clinical Pearl video on pediatricnutritionce.org.